If your baby's HIE diagnosis involved nuchal cord, you're probably asking yourself this: could this been prevented? Was this something that didn't have to happen? Hello, I'm Marcus Boss. I'm a birth injury lawyer, and today I want to help you understand when a nuchal cord might signal a preventable injury. We'll cover things like monitoring, interventions, and signs that something may have went wrong during labor and delivery. And what I want to do is give you a clearer picture as to what you should be looking out for. So let's get started with this question that I often get. Was my baby's nuchal cord, was it preventable? Actually, nuchal cords are quite common and they can occur in many births. However, when the cord is wrapped tightly, especially if it's wrapped twice, this can increase the risk for oxygen deprivation. While doctors may not always detect this on an ultrasound, they should still be vigilant for any signs of fetal distress. It's their responsibility to monitor for complications, and a tight nuchal cord can cause complications sometimes. This brings us to monitoring. When there's a possibility that a nuchal cord could interfere with oxygen flow, continuous monitoring of your baby's heart rate during labor, it becomes essential. Medical staff should be attentive to any types of changes that could indicate that the baby might be in distress. Cord compression, umbilical cord compression, it happens when a nuchal cord tightens, restricting blood flow, which can lead to a decreased level of oxygen delivery to your baby. This is often manifests itself on the fetal monitor as variable decelerations, which are sudden drops in your baby's heart rate. The appearance of these types of patterns should prompt medical staff to take immediate action to safeguard your baby's oxygen supply. Timing with all of this is crucial. When a tight nuchal cord is present, particularly with signs of distress, every moment counts. Your medical team has options, including proceeding with a C-section if they need to, things to ensure that your baby is delivered quickly if their oxygen levels are compromised. Recognizing and responding to signs of distress could mean the difference between a safe delivery and a preventable injury. If nuchal cord is causing harm, there is no time to hesitate. You have to move on it. If a C-section was performed, reviewing the surgical notes is crucial. Check the doctor's notes and look and see how the doctor described the nuchal cord. Did they note it as a tight cord or was it loose? If it's described as tight, this could correlate with the variable decelerations that we discussed earlier, indicating that the cord might have been causing significant distress. This type of documentation provides insight into how the medical team assess the situation and whether they act appropriately during labor and delivery. So what if these signs were overlooked? Or what if there was a delay in responding? Look for specific red flags when reviewing the medical records. Ignoring variable decelerations, delaying necessary interventions, or failing to document important details can indicate that negligence might have happened. Understanding what the standard of care should have been can help you determine if something may have went wrong with your case. You might have heard nuchal cords, they can just happen. And while that is true, it doesn't tell the whole story all the time. Most nuchal cords, they don't lead to complications, but tight or prolonged constriction can pose significant risk to your baby. It's vital to distinguish between routine occurrences, situations that will require action. If your doctor dismisses your concerns with "it just happens," you deserve clarity to understand what may have happened and to be able to see if a different response was warranted. Again, I'm Marcus Boston, and if you have any other questions about your baby's HIE brain injury from a medical legal standpoint, don't hesitate to reach out and contact me. You can find out more information about me in my profile, or you can just wait to the end of this video and take a look at the picture that follows. All right, that's going to be it for today's quick educational video. Have a great day, everybody.